Welcome to evergreenmd.org. I'm Matt Jablow. As a result of the Affordable Care Act, Maryland residents now have many more options for quality, affordable health insurance than they've had in the past. Most people would probably agree that's a good thing, but it's also complicated with so many health plans to choose from. Joining us now to help explain what people should be looking for in a health insurance plan is Bob Harnett, Senior Vice President of Product Development here at Evergreen Health Co-op. Bob, first of all, in your opinion, what's the most important thing, or some of the most important things that people should be looking at when they're comparing health insurance plans online, as most people will be?
Well, there's so much more that goes into picking an insurance product than just the price and just the premium that you're going to pay. It's a very, very personal decision, and it's tied up in a lot of the things that an individual has going on in their life, how much they use their health care, what type of risk that they feel that they can take on for unforeseen expenses. So when somebody is looking at it, it's really important that they get under the hood of the insurance plan to see what's covered and what's not covered, and how much they would have out of pocket if something were to happen.
I think a lot of people are also concerned, people I talk to are wondering, they're concerned, if they choose a new health plan, if they go to Evergreen Health, for example, will they be still allowed to use the doctors that they know and like now?
Well, that's certainly one of the first things that we want people to look at, and Evergreen Health has two types of insurance products. They have a traditional insurance product which will allow people to keep their own doctor and see whoever they want at any time, whatever they want. The other set of plans is our Evergreen Healthcare plans, and that's really the differentiator for Evergreen in the market. The Evergreen Healthcare plans are tied to our local healthcare centers, which are providing a low-cost, high-quality access to primary care services for people who may not be actively engaged with a primary care doctor. So the first decision that somebody wants to make is, do they have a doctor that they like? Are they regularly seeing a physician that's not an Evergreen Healthcare doc? And if they're not, then they could take a good look at the Evergreen Healthcare plans to see if those are a good fit for them.
The metal plans that people see when they go online looking for health insurance plans, what's the difference and what should people be looking for?
Well, it is very confusing, and it's a complex decision when you get down to that level. And keep in mind that the plans are divided into the metals, like you said, gold, silver, and bronze, but then there's an additional level on top of that where there's a gold plus and a silver plus as well, so just to make it even more complicated for people. But the big difference between the two sets of plans is what is the level of service that you think you need and how much you want to pay when you go to the doctor. If you don't go to the doctor that often, maybe once a year, or occasionally if you have a cold, then perhaps the straight metal plans, the gold, silver, and bronze would be good for you. Those are co-insurance plans. So you're going to pay a set amount of money depending upon the metal level that you pick, and you're going to have to pay that before you get any insurance benefit whatsoever. If you have more frequent services, or you have more frequent needs of going to the doctor for you or your family, then you want to look at one of the plus plans, because those are co-payment plans. So when you go to see the doctor, you might pay $20 or $25 depending upon what type of plan you have, and then you get the services associated with that particular visit, and that's all you have to pay. And of course, keep in mind that all of these plans offer all of the preventive services, so your annual physicals and your typical flu shots and things like that are covered at 100%, no cost to the member whatsoever, regardless of what plan you pick.
The bottom line is there's a lot for people to consider.
That's right, and it really comes back to, it's very, very important that they look at beyond just the price of the plan, because a lot of the marketplaces and shopping services that are out there, whether you're getting it from the Maryland Exchange with a subsidy or getting it directly from an insurance carrier, the focus is on just the premium, and there's so much more that goes into making that type of a decision, and you really have to take into account what your particular situation is.
Bob, thanks so much. A lot of good information. Thanks for joining us, and thank you for watching. I hope you found this helpful. If you want more information about any of the plans offered by Evergreen Health, feel free to call us at 443-839-0585.